ever paused to consider that your bedtime habits might be silently endangering your well-being? It's a startling reality, but according to recent CDC statistics, annually over 70,000 elderly individuals pass away during slumber in America alone. What's particularly alarming isn't just these numbers, but the revelation that many of these fatalities aren't simply natural age progression. They're directly connected to avoidable sleep-related behaviors that most individuals never scrutinize. As we journey through our golden years, our physiological systems become increasingly sensitive to even minor alterations. Beyond the age of 60, vital systems like your cardiovascular functions, cognitive processes, and respiratory mechanisms all develop heightened vulnerabilities. Sleep architecture transforms, muscular strength diminishes, and the potential hazards associated with seemingly innocent bedtime practices magnify substantially. Despite these changes, the majority of elderly individuals maintain identical routines. They've practiced for decades, completely unaware that these patterns might be secretly undermining their health and potentially abbreviating their lifespans. So what exactly are these concealed threats lurking within your evening routine? Which commonplace sleep-related habit triggers more emergency situations than any other? And what straightforward modifications can you implement this very evening to safeguard yourself and those you cherish? In this comprehensive exploration, we'll examine 7 prevalent sleep behaviors that have already claimed numerous elderly lives this calendar year. Pay particular attention to habit number 2. It's by far the most hazardous and absolutely essential information you won't want to overlook. Rest assured, I'll also provide proper guidance so you can experience peaceful, secure slumber every night. For those newly discovering our wellness community, a warm welcome. Let's embark on this health optimization journey together. We're absolutely thrilled to accompany you on this path toward enhanced well-being. We're genuinely curious about our global audience. Please share your location in the comment section below. Now let's delve into these critical insights about the 7 perilous sleep habits you absolutely must eliminate from your routine. 1. Excessive hydration before sleep. Let's begin with a seemingly beneficial practice that frequently goes unexamined precisely because it appears so health-conscious: drinking water before bed. Proper hydration is undeniably essential for everyone, particularly older adults. Water supports cellular function throughout your body, assists with thermoregulation, enhances digestive processes, and maintains joint lubrication for comfortable movement. However, here's the crucial distinction. While maintaining adequate hydration is fundamentally important, consuming excessive liquids immediately before retiring can potentially endanger your health in unexpected ways. As we transition into our later years, our bodies process fluids differently. The renal system, responsible for filtering waste from bloodstream and maintaining fluid balance, becomes progressively less effective with advancing age. Simultaneously, bladder capacity diminishes, while the neurological signals indicating urination necessity become more urgent and occur with increased frequency. This physiological reality means that consuming substantial quantities of water, herbal infusions, or fruit beverages within the hour or two preceding bedtime dramatically increases the likelihood of nocturnal awakenings for bathroom visits. For younger individuals, these interruptions might seem trivial, but for seniors, they represent significant hazards. Nocturnal bathroom excursions rank among the primary causes of falls among elderly populations. Consider this scenario. You're semi-conscious, navigating through darkness, experiencing orthostatic hypertension upon standing with reduced equilibrium capabilities compared to your younger years. These combined factors transform a routine bathroom visit into a potentially dangerous situation. CDC research confirms that falls constitute the primary cause of injury-related hospitalizations among seniors, with a substantial percentage occurring during nighttime hours. But the potential complications extend beyond physical injuries. When you experience multiple awakenings for urination, your sleep architecture becomes fragmented. You miss crucial deep restorative sleep phases, essential for neurological and physiological repair and regeneration. Chronic sleep disruption correlates with cognitive impairment, elevated inflammatory markers, and heightened risk for developing neurodegenerative conditions like dementia and Alzheimer's disease. Additionally, compromised sleep quality can weaken immunological function and complicate management of chronic conditions such as hypertension and diabetes. An often overlooked risk involves cardiovascular strain. When you consume substantial fluids before sleeping, your cardiovascular system must work harder to process and eliminate excess liquid. This can trigger blood pressure fluctuations and impose additional burden on your heart, especially if pre-existing cardiac conditions exist. For some elderly individuals, this added stress may precipitate cardiac arrhythmias or more serious complications. So what's the optimal approach to maintain hydration without exposing yourself to unnecessary risk? The key elements are timing and moderation. Prioritize fluid intake throughout daytime hours, but begin reducing consumption in late afternoon and early evening. Aim to avoid significant fluid intake at minimum 2 to 3 hours before bedtime. If experiencing thirst before sleep, take minimal sips rather than consuming full beverages. Additionally, avoid diuretic beverages in evening hours. These include caffeinated drinks like coffee, black or green tea, energy drinks, alcohol, and certain fruit juices that may increase urination frequency and volume. Even some herbal teas can have mild diuretic effects, so checking with healthcare providers about specific beverages is advisable. For those who inevitably need to rise during night hours, implement safety measures. Ensure pathways remain well illuminated and obstacle-free. Consider installing motion-activated lighting systems to reduce fall risk. Move deliberately and allow your body momentary adjustment before fully standing. Some medical experts also recommend keeping a portable urinal nearby for especially vulnerable individuals, eliminating the need for bathroom journeys entirely. By implementing these straightforward adjustments, you can maintain essential hydration while reducing nocturnal awakening frequency, minimizing accident risk, and supporting comprehensive health without sacrificing hydration benefits. 2. Late-night eating habits. Let's address another seemingly innocuous habit with potentially serious repercussions: consuming food late in the evening. For many individuals, a bedtime snack represents a comforting ritual, a pleasant way to conclude a demanding day. However, for elderly individuals, this apparently harmless practice can initiate a cascade of health complications extending far beyond minor digestive discomfort. As aging progresses, our digestive systems undergo significant transformations. Metabolic processes decelerate, digestive efficiency decreases, and the body's capacity to regulate blood glucose and cholesterol weakens considerably. When late-night eating occurs, particularly with heavier, nutrient-dense foods, your digestive system remains actively working long after you've retired to bed. Instead of entering restorative mode, your physiological systems continue processing nutrients, potentially disrupting sleep architecture and imposing additional strain on cardiac functions and other vital organs. Among the most immediate concerns associated with evening eating is gastroesophageal reflux. When lying down shortly after eating, stomach acids more readily flow backward into the esophagus, creating that characteristic burning sensation in the chest region. For elderly individuals, this represents more than mere discomfort. It potentially leads to chronic inflammation, esophageal tissue damage, and even increased risk of aspiration pneumonia if acidic content or food particles inadvertently enter the respiratory system during sleep. Research published in prestigious gastroenterological journals indicates that individuals consuming meals within 3 hours of bedtime experience significantly higher incidence of nocturnal reflux and associated complications. Professional medical organizations now recommend maintaining a minimum 3-hour interval between your final food consumption and sleep initiation to minimize these risks. However, the potential complications extend beyond reflux concerns. Evening eating can dramatically elevate blood glucose levels, particularly when meals include refined carbohydrates or sugar-containing foods. As we age, insulin sensitivity naturally decreases, meaning our bodies become less efficient at regulating blood sugar. Consequently, late evening nutritional intake can result in prolonged hyperglycemia throughout nighttime hours, potentially increasing type 2 diabetes risk or complicating management for those already diagnosed with the condition. Contemporary research from endocrinological publications demonstrates that late-night eating correlates with elevated morning blood glucose and insulin measurements, particularly among older adults. Chronically elevated nocturnal blood sugar levels increase inflammatory processes throughout the body and may contribute to numerous age-related conditions. Cardiovascular implications demand serious consideration as well. Eating late potentially prevents the normal nocturnal blood pressure decrease that should occur during restful sleep. This non-dipping blood pressure pattern correlates with increased risk for serious cardiovascular events, including myocardial infarction and cerebrovascular accidents, especially among elderly populations. Heavy or fat-rich evening meals may also trigger cardiac arrhythmias, irregular heartbeats, potentially dangerous for individuals with pre-existing cardiovascular conditions. A sophisticated understanding of digestive timing also reveals that our digestive enzymes naturally decrease production during evening hours, aligned with our circadian rhythms. This means later meals digest less efficiently, potentially remaining in the digestive tract longer and increasing fermentation, gas production, and discomfort throughout the night. What preventative strategies can you implement? The fundamental principle involves allowing your digestive system adequate processing time before horizontal positioning for sleep. Aim to conclude your evening meal minimum 3 to 4 hours before bedtime, earlier if possible. Select lighter nutritional options for evening consumption. Emphasize lean proteins, vegetables, and complex carbohydrates rather than fried items, processed pastas, or sugary confections. If evening hunger genuinely requires addressing, select small, easily digestible options, perhaps a small piece of fresh fruit, plain yogurt with minimal sugar content, a small handful of raw, unsalted nuts, or a light protein source like a small portion of cottage cheese. Experts also recommend avoiding spicy foods, heavily processed items, and carbonated beverages in evening hours, as these commonly exacerbate digestive discomfort and reflux symptoms. Implementing intermittent fasting principles may provide additional benefits for many individuals. Research indicates that extending overnight fasting periods, 12+ hours between dinner and breakfast, potentially improves metabolic health, reduces inflammation, and supports healthy weight management, all particularly valuable for elderly populations. By implementing these straightforward modifications, you'll likely experience improved sleep quality while simultaneously reducing risk factors for nocturnal reflux episodes, blood sugar instability, and serious cardiovascular incidents. Your entire physiological system will benefit from proper nutritional timing that aligns with your body's natural rhythms and digestive capabilities. 3. Improper sleep positioning. Most individuals maintain preferred sleeping positions night after night, rarely considering the potential health implications of these habitual postures. Yet research clearly demonstrates that sleep positioning significantly impacts health outcomes, particularly as aging progresses. For elderly individuals, positional choice dramatically influences respiratory function, cardiovascular health, and even stroke risk. Let's examine the most problematic positioning first: supine sleeping, lying flat on your back. While potentially comfortable for some individuals, this position creates ideal conditions for respiratory obstruction in aging bodies. During back sleeping, gravitational forces cause tongue and pharyngeal soft tissues to relax posteriorly, partially obstructing your airway. This presents particular danger for individuals with sleep-disordered breathing or obstructive sleep apnea, though even those without formal diagnosis may experience subtle airflow limitations. Advanced research from leading sleep medicine centers indicates that supine positioning can worsen breathing difficulties by approximately 40% compared with lateral positioning, side sleeping. The consequences of such airway obstruction are profound. Reduced oxygen circulation during sleep potentially leads to recurring episodes of obstructive sleep apnea, characterized by repeated breathing cessations and resumptions. Over time, chronic nocturnal oxygen deprivation potentially contributes to neurological damage, elevated blood pressure measurements, and substantially increased risk for cerebrovascular accidents and cardiac events. Contemporary research demonstrates that elderly individuals maintaining supine sleeping positions experience approximately 22% higher incidence of nocturnal cardiac episodes compared with lateral sleepers. The complications extend beyond respiratory concerns. For individuals experiencing gastroesophageal reflux or hiatal hernia, supine positioning facilitates retrograde movement of gastric acids into the esophagus, causing silent nocturnal reflux. Beyond immediate discomfort, this chronic acid exposure potentially damages esophageal lining and increases aspiration risk when stomach contents inadvertently enter pulmonary tissues, potentially leading to infectious pneumonia or overextended periods, contributing to esophageal carcinoma development. Neurological implications warrant serious consideration as well. Groundbreaking research from prestigious university medical centers reveals that supine sleeping reduces glymphatic system efficiency, the brain's waste clearance mechanism, by approximately 63% compared with lateral positioning. This suggests that harmful protein accumulations associated with neurodegenerative conditions like Alzheimer's disease and related dementias may not be effectively eliminated, potentially accelerating cognitive decline. Even right-side sleeping presents certain concerns, as this position potentially compresses major cardiac blood vessels, impeding circulation and potentially increasing heart failure risk among vulnerable individuals. Compression of the vena. Cava, a major blood vessel returning blood to the heart, may be particularly problematic for individuals with cardiovascular vulnerabilities. Given these considerations, what represents optimal positioning? Sleep medicine specialists overwhelmingly recommend left lateral positioning for most individuals. This position optimizes circulatory function, supports digestive processes, and minimizes gastroesophageal reflux and stroke risk. Additionally, it enhances brain waste clearance efficiency, supporting long-term cognitive function. For individuals accustomed to supine or right lateral positioning, transition may initially prove challenging. Supportive strategies include utilizing firm pillows between knees to maintain proper spinal alignment, positioning additional pillows posteriorly to prevent nocturnal repositioning, and employing specialized orthopedic pillows designed to maintain comfortable and anatomically correct positioning throughout sleep duration. For individuals with reflux concerns, elevating the bed head by 6-8 inches, not merely adding pillows, which may increase neck strain, can further reduce symptom frequency and severity. Positional therapy devices, specialized items designed to discourage supine positioning, may benefit some individuals. These range from simple tennis balls sewn into nightwear backs to advanced electronic devices providing gentle vibration when supine positioning is detected, encouraging repositioning without fully awakening the sleeper. Training yourself to maintain left lateral positioning potentially provides substantial protection against nocturnal breathing difficulties, cardiovascular complications, and cognitive deterioration, promoting restorative sleep and comprehensive morning rejuvenation. 4. Elevated bedroom temperature. With advancing age, many individuals gravitate toward increased warmth and comfort, raising thermostat settings, adding heavier blankets, or closing windows to eliminate drafts. However, sleeping in excessively warm environments potentially endangers health, particularly for elderly individuals. Maintaining appropriate bedroom temperature represents not merely a comfort consideration, but a crucial safety factor. Human physiology naturally requires core temperature reduction as sleep initiation occurs. This natural thermoregulatory decline signals the brain that rest time has arrived, facilitating transition into deeper, more restorative sleep stages. When bedroom environments exceed approximately 70 degrees Celsius, this cooling process faces disruption. Rather than relaxing, your body must work continuously to eliminate excess heat, potentially causing restlessness, frequent awakenings, and morning fatigue. For elderly individuals, the consequences extend far beyond simple discomfort. As aging progresses, thermoregulatory capacity naturally declines, increasing vulnerability to overheating. Research published in geriatric medicine journals indicates that older adults sleeping in environments exceeding 70 degrees experience approximately 30% reduction in slow-wave sleep, the crucial deep restorative phase essential for memory consolidation, immune function enhancement, and cellular repair processes. This crucial sleep phase deficit potentially creates cascading health effects. Compromised sleep quality correlates with increased inflammatory markers, elevated blood pressure measurements, and immunological suppression. Over time, these alterations potentially increase risk factors for cardiovascular disease, metabolic disorders like diabetes, and even accelerated cognitive decline. The same research indicates that chronic sleep disruption resulting from overheated sleeping environments potentially accelerates age-related memory deterioration and reduces immunological efficiency against infectious agents. Physiological risks extend to dehydration concerns, particularly relevant for elderly individuals already experiencing diminished thirst sensation. Nocturnal perspiration causes fluid and electrolyte losses, potentially increasing blood viscosity and elevating risk. Factors for thrombosis, blood clot formation, cardiac arrhythmias, and cerebrovascular events. For individuals with pre-existing cardiac or respiratory conditions, the additional physiological strain from thermoregulatory efforts potentially triggers serious complications, including acute cardiac events or respiratory distress. Beyond temperature concerns, proper ventilation deserves consideration. Inadequate air circulation potentially increases carbon dioxide concentration within sleeping environments, subtly reducing oxygen availability and potentially contributing to morning headaches, cognitive fogginess, and general fatigue. Recent research suggests potential connections between poor bedroom ventilation and various respiratory conditions, particularly among elderly populations. What constitutes ideal temperature parameters for safe, restorative sleep? Sleep medicine. Specialists typically recommend maintaining bedroom environments between 60-67 degrees, 15-19 degrees, significantly cooler than many individuals initially find comfortable. Utilizing lightweight, breathable bedding materials, particularly natural fibers like cotton, helps regulate temperature effectively while avoiding heat trapping that occurs with synthetic materials or electric blankets. For individuals concerned about feeling cold, layering multiple lightweight blankets provides better temperature regulation than single heavy coverings, allowing easy adjustment throughout the night as needed. Consider using ceiling or portable fans to improve air circulation or slightly opening windows, security permitting, to enhance ventilation quality. For those living in warmer climates without air conditioning access, alternative cooling strategies include using lightweight, breathable sleepwear, dampening sheets slightly before bed, particularly effective in low humidity environments, employing cooling pillows containing gel inserts specifically designed to dissipate heat, or utilizing bed fans that circulate air specifically between sheets. Some individuals benefit from taking brief, lukewarm showers before bedtime, which counterintuitively helps lower core body temperature as the body adjusts afterward. Staying properly hydrated throughout the day, while being mindful of limiting evening fluid intake, as previously discussed, also supports proper thermoregulation during sleep hours. By implementing these straightforward environmental modifications, you potentially protect cardiovascular function, support neurological health, and ensure access to the deep, restorative sleep your body requires. Remember, a properly cooled bedroom environment isn't merely about comfort. It represents a powerful protective strategy for safeguarding health throughout aging processes. 5. Rapid bed egress. Have you experienced waking during night hours, quickly swinging legs from bed, then suddenly feeling room spinning or vision temporarily darkening? This common experience represents more than simple imagination. For elderly individuals, rising too quickly from recumbent positions potentially creates dangerous situations responsible for numerous falls, injuries, and hospitalizations annually. The primary mechanism behind this phenomenon involves orthostatic positional hypertension, a sudden blood pressure reduction occurring when transitioning from lying to standing too rapidly. Advancing age reduces physiological efficiency in adjusting blood flow and pressure during positional changes. Consequently, blood momentarily pools in lower extremities, temporarily reducing oxygenated blood flow to the brain. This briefly insufficient cerebral circulation creates sensations of dizziness, lightheadedness, or even near syncope, pre-fainting. Beyond momentary discomfort, this represents genuine danger. Research published in premier medical journals demonstrates that older adults experiencing orthostatic hypotension face significantly elevated risks for falls, fractures, and even mortality. Falls constitute the leading cause of injury-related hospitalizations among elderly populations, with substantial percentages occurring during nighttime or early morning hours, when blood pressure naturally reaches lowest levels and the body continues adjusting from sleep state. The potential consequences of nocturnal falls include serious injuries. Hip fractures, concussions, vertebral compression fractures, and wrist fractures commonly occur. Recovery typically progresses slowly, often with complications. For many individuals, a single serious fall potentially initiates declining independence, extended hospitalizations, or even life-threatening complications. Certain medications commonly prescribed for elderly individuals potentially exacerbate orthostatic hypotension. These include many antihypertensives, diuretics, antidepressants, anxiolytics, and vasodilators. When combined with natural age-related changes in baroreceptor sensitivity, pressure sensors regulating blood pressure, these medications potentially create perfect conditions for dangerous blood pressure drops during positional changes. Additionally, nocturnal dehydration, common among elderly individuals who limit evening fluid intake to reduce bathroom visits, potentially increases orthostatic hypertension severity by reducing overall blood volume. This creates a challenging balance between limiting fluids to prevent nighttime awakening and maintaining sufficient hydration to prevent dangerous blood pressure fluctuations. What preventative strategies can reduce these risks? Implementing several simple behavioral modifications potentially create substantial protection. First, avoid rapid transitions from lying to standing positions. Upon waking, remain recumbent momentarily before slowly transitioning to seated position at bedside. Pause in this intermediate position while performing gentle movements, wiggling toes, flexing ankles, and slowly rotating shoulders helps activate circulation. Take several deep, controlled breaths to enhance oxygenation before gradually transitioning to standing position. Maintain proper bedside hydration with small water quantities readily available. Taking modest sips before rising potentially helps. Stabilize blood pressure, particularly for individuals prone to dehydration. Never rise rapidly, particularly when feeling lightheaded or disoriented. Ensure pathways to bathroom facilities remain well illuminated, using nightlights or motion-activated lighting systems to prevent tripping hazards. Secure potential handholds along regular pathways. Consider installing properly mounted grab bars or ensuring furniture placement provides stabilization opportunities during nighttime navigation. Address environmental hazards proactively. Secure loose carpeting, remove obstacles from common pathways, and consider using non-slip flooring in bathroom areas. Wear properly fitting, non-slip footwear for nighttime ambulation rather than loose slippers or walking barefoot on potentially slippery surfaces. For individuals taking medications potentially affecting blood pressure, consult healthcare providers about optimal administration timing and potential dosage adjustments. Some medications function better when taken at specific times relative to sleep patterns. Some individuals benefit from compression stockings that prevent blood pooling in lower extremities, though these should only be used with medical guidance. For high-risk individuals, consider employing bedside commodes to eliminate longer bathroom journeys entirely. By implementing these straightforward precautions, you potentially dramatically reduce nighttime fall risks while protecting long-term health and independence. Remember, rising slowly isn't merely about comfort. It represents a powerful protective strategy against one of the most common and dangerous situations facing elderly individuals. 6. Untreated sleep-disordered breathing. Snoring frequently receives dismissal as merely annoying, particularly as aging progresses. However, consider this alarming possibility. What if nighttime noises or breathing irregularities actually represent warning signals of potentially life-threatening conditions? For elderly individuals, ignoring symptoms like chronic snoring, breathing pauses, or persistent insomnia potentially establishes preconditions for serious health deterioration. Among the most dangerous yet underdiagnosed sleep disorders affecting older adults is obstructive sleep apnea, OSA. This condition occurs when pharyngeal musculature excessively relaxes during sleep, causing airway narrowing or complete closure. Consequently, breathing potentially ceases for several seconds, sometimes hundreds of times nightly. Each apneic episode reduces blood oxygen saturation, forcing cardiovascular systems to work harder, maintaining adequate oxygenation. Over time, this recurring strain potentially leads to hypertension, cardiac arrhythmias and substantially increased risk for myocardial infarction and cerebrovascular incidents. Statistical analysis proves alarming. According to comprehensive sleep cardiovascular research, untreated sleep apnea increases fatal cardiac event risk by approximately 30% and stroke risk by up to 60% among elderly populations. Even more concerning, approximately 40% of seniors experience sleep apnea, yet an estimated 80% of cases remain undiagnosed. Many individuals simply don't recognize that snoring or restless sleep represents serious medical condition symptoms requiring intervention. The dangers extend beyond cardiovascular concerns. Sleep apnea deprives individuals of deep restorative sleep necessary for optimal neurological function. Chronic sleep deprivation potentially leads to memory impairment, decreased concentration, mood disturbances, and potentially accelerated neurodegenerative disease progression. Research demonstrates that seniors with untreated moderate to severe sleep apnea experience brain volume reduction in memory and executive function regions at nearly triple the normal age-related rate. Sleep apnea creates systemic inflammation throughout the body, potentially exacerbating arthritis symptoms, increasing insulin resistance, and compromising immune function. Some research suggests potential connections between untreated sleep apnea and increased cancer risk, though these relationships require further investigation. How might you identify potential sleep apnea or related disorders? Often household members first notice characteristic signs: loud, persistent snoring, interrupted by silent periods, breathing pauses, followed by gasping or choking sounds during sleep resumption, and frequent nighttime awakenings. Additional warning signals include morning dry mouth or headaches, excessive daytime fatigue, difficulty maintaining wakefulness during sedentary activities, and personality changes, including irritability or depression. Insomnia, difficulty initiating or maintaining sleep, potentially signals underlying cardiovascular, neurological, or hormonal disturbances when occurring chronically. Beyond immediate discomfort, persistent insomnia potentially weakens immunological function, increases stress hormone production, and complicates management of conditions like hypertension and diabetes. If recognizing these symptoms in yourself or household members, don't minimize their significance. Consult healthcare providers or sleep medicine specialists promptly. Contemporary diagnostic procedures have become increasingly accessible and comfortable, with many evaluations now possible through home-based testing rather than requiring laboratory sleep studies. Effective interventions significantly reduce associated risks. Continuous positive airway pressure, CPAP therapy, while requiring adjustment periods, dramatically improves outcomes for most individuals, reducing cardiovascular event risk by up to 42% in seniors with sleep apnea. Alternative therapies including specialized oral appliances, positional therapy, targeted weight management, and in some cases, surgical interventions may benefit specific individuals. Addressing insomnia typically involves comprehensive approaches, including cognitive behavioral therapy, specifically designed for sleep disturbances, CBTI, careful medication management, and addressing underlying conditions potentially disrupting sleep architecture. Improvements in sleep hygiene practices, maintaining consistent sleep schedules, creating appropriate sleep environments, and limiting evening stimulation provide foundation for most therapeutic approaches. Remember, snoring and sleep disruptions aren't merely nuisances. They represent potential signals of underlying conditions requiring attention. By recognizing symptoms and seeking appropriate intervention, you potentially protect cardiovascular function, neurological health, and overall quality of life. 7. Medication timing concerns. For many elderly individuals, evening medication consumption represents firmly established routine, whether sleep-inducing pharmaceuticals addressing insomnia, antihypertensives managing blood pressure, or analgesics alleviating joint discomfort. These practices seem innocuous, simply another component of evening wind-down processes. However, certain medications taken near bedtime potentially create unintended, sometimes dangerous effects, particularly as aging progresses. Let's examine sedative hypnotic medications commonly prescribed for insomnia and anxiety conditions. Benzodiazepines, including diazepam, clonazepam, alprazolam, and related medications, function by suppressing central nervous system activity. While potentially facilitating relaxation and sleep initiation, these medications simultaneously reduce respiratory drive, resulting in slower, shallower breathing patterns. For elderly individuals, particularly those with cardiac or pulmonary conditions, this respiratory depression potentially creates significant risks. Comprehensive research published in respected medical journals indicates that older adults regularly using benzodiazepines experience significantly elevated risks for falls, fractures, cognitive impairment, and mortality compared with non-users. Sedative effects potentially persist into morning hours, causing daytime dizziness, confusion, and unsteadiness, all factors increasing accident probability. The sedative medication paradox deserves consideration. While these pharmaceuticals may initially improve subjective sleep quality, they simultaneously suppress crucial deep sleep phases, particularly REM and slow-wave sleep, essential for memory, consolidation, and cognitive function. Over extended periods, this disruption potentially contributes to increased forgetfulness, confusion, and potentially accelerated cognitive decline. Analgesic medications, particularly non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, naproxen, or diclofenac, present additional concerns when used regularly near bedtime. These medications potentially increase renal and hepatic burden, complicating toxin elimination processes. They potentially increase internal bleeding risk, particularly when combined with other medications affecting coagulation, including many commonly prescribed cardiac medications. Antihypertensive. Timing warrants careful consideration. While some individuals benefit from evening administration, particularly for controlling morning blood pressure elevations, for others, this timing potentially causes excessive nocturnal blood pressure reduction. Hypoperfusion, reduced blood flow to critical organs, particularly the brain, potentially increases dizziness, syncope, and cerebrovascular event risks. Recent hypertension research demonstrates that medication timing significantly influences nocturnal blood pressure patterns and overall cardiovascular risk profiles. Polypharmacy, concurrent use of multiple medications, creates additional hazards as aging progresses. Our bodies process pharmaceuticals more slowly with advancing age, increasing potential for one medication to amplify effects or side effects of others. Combining sedatives, analgesics, and other medication categories without medical supervision potentially leads to dangerous or life-threatening interactions. Certain antidepressants, particularly some tricyclic compounds, potentially cause cardiac conduction disturbances when administered near bedtime, especially concerning for individuals with pre-existing arrhythmias or conduction abnormalities. Others may increase nocturnal urination frequency, disrupting sleep continuity. Some medications, including certain statins, diuretics, and stimulating antidepressants, potentially cause insomnia when administered evening hours. Yet many individuals continue evening dosing due to established routines rather than optimal. Therapeutic timing. What protective strategies should you consider? First, maintain open communication with healthcare providers and pharmacists regarding all medications, both prescription and over-the-counter, consumed regularly. Request comprehensive medication reviews addressing potential interactions and optimal administration timing for each pharmaceutical. Discuss persistent side effects, including confusion, dizziness, excessive drowsiness, or sleep disturbances with healthcare providers promptly. Often, simple timing adjustments or alternative medication options significantly reduce adverse effects while maintaining therapeutic benefits. When possible, explore non-pharmacological approaches for common concerns like insomnia or mild pain management. Cognitive behavioral therapy, specifically for insomnia, CBTI, demonstrates superior long-term outcomes compared with medication approaches for many individuals. Similarly, physical therapy, appropriate exercise programs, and non-pharmaceutical pain management techniques potentially reduce reliance on medications carrying substantial side effect profiles. If taking blood pressure medications evening hours, consider home monitoring to track patterns and report unusual symptoms to healthcare providers. Some individuals benefit from 24-hour ambulatory blood pressure monitoring to determine optimal medication timing based on individual circadian blood pressure patterns. Particularly for high-risk medications like sedatives or opioid analgesics, discuss potential dose reductions or alternative approaches with healthcare providers. As aging progresses, effective dosages typically decrease significantly. Continuing, youthful dosing potentially increases adverse effect risks unnecessarily. By maintaining proactive, informed approaches regarding medication routines, you potentially protect your health, reduce nighttime accident risks, and promote safer, more restorative sleep experiences. Simple adjustments potentially create significant improvements in safety and longevity. As we conclude this exploration, it becomes evident that even minor adjustments to evening routines potentially create profound impacts on health, safety, and longevity. Now armed with awareness regarding these 7 dangerous sleep habits, the essential next step involves implementing protective changes beginning tonight. Whether adjusting bedroom temperature settings, reconsidering evening nutritional choices, modifying sleep positioning, or consulting healthcare providers about medication timing, every positive modification contributes toward extended, healthier living. The cumulative effect of seemingly small changes often produces remarkable improvements in sleep quality, daytime functioning, and overall well-being. Have you previously engaged in these potentially risky behaviors without recognizing associated dangers? Or perhaps you've discovered strategies that have enhanced your sleep quality and safety. Share your experiences and insights in the comments section below. Your story potentially helps others within our community. If you found value in this information, please consider supporting our continuing education efforts by subscribing to our channel and joining our wellness community. Your engagement enables us to continue providing evidence-based health optimization strategies for individuals at every life stage. Remember, the journey toward improved sleep quality and enhanced health begins with simple, consistent steps taken daily. By implementing the protective strategies we've discussed, you're making powerful investments in your future well-being and quality of life. Thank you for your attention and continued support of our educational initiatives. We genuinely look forward to accompanying you on your journey toward optimal health and vitality.